Well, the pandemic has definitely impacted a lot of things, including the lives of those living with MS. Here to tell us more about that is Dr. Barry Hayden, who brought along a patient who's been living with MS and has been treated for it.
I tell people that everybody with MS has their own unique story. Everybody's a snowflake. So that the approach to everybody and the challenges of any individual are really that individual. And so we have to have a team. And if the issues are mobility, that we have a teammate who can deal with that, whether that's a therapist or a physiatrist. If it's mood, that we have a psychiatrist. If it's bladder, we have a urologist. But mostly it is that the challenges, though unique to the individual, the goals remain the same. And that is that we find a therapy for that individual that fits them, that reduces relapse, reduces progressive disability, and maintains a good quality of life.
Absolutely. And Crystal, can you tell us what's been the hardest part of living with MS during the pandemic?
Like most people, the isolation during quarantine times. I definitely I was starting a new, I was doing my second round of a new medication called Mavenclad. And I know that in the first 3 months following that my immune system is supposed to be knocked down just a little bit, which makes me more susceptible to infection. So that caused me to be a little bit more diligent and communicating a little more with my physician via telehealth. So, making the right decisions for our family on whether I go back to work in person, my kids go back to school in person, and with the extra the labs that we had drawn, and it made me more comfortable in sending my kids to school in person, and it made me more comfortable in going back to work in person.
Well, that's definitely good news. Doctor, can you tell us, how has COVID really impacted patients being treated for MS currently?
Sure. One thing that's obvious is our greater reliance on telehealth, but the more important one in terms of the question you asked is the question from my patients as to whether or not MS increases their risk for COVID-19 or whether their therapies increase their risk for COVID-19. And the answer is reassuring, and that is having MS does not appear to uniquely increase the risk of MS as long as there are no significant comorbidities. That means people who have diabetes, who are uncontrolled or smoking or are not exercising, et cetera, all the more reason for us to have them concentrate on wellness and good habits, that they should wear masks, wash their hands, maintain social distancing. There was also some initial questions whether the medications would, in some cases, create increased hazard. But the American experience has been a very favorable one, and that is that we are seeing that people on MS agents, on MS therapies, appear to be doing well, and that we should be advising our patients not to stop their therapy, not to change their therapy without talking to their clinician, but rather to use the right medication for them. Outcomes for people with MS and COVID have mirrored the general population.
And Crystal, can you share with us what your diagnosis was like and how long have you been living with MS?
I originally started showing symptoms whenever I was in childhood, early childhood, but it wasn't until I was in nursing school planning for my wedding, the stressors that caused a significant relapse. It was actually in 2003, whenever I was officially diagnosed. I had developed some pretty significant symptoms, blindness in my left eye and some paralysis in my left side. And that warranted the MRI, and then later, a couple weeks later, confirmed with a lumbar puncture that yes, I do have MS, and so that's how initially I got diagnosed.
And doctor, can you tell us about Mavenclad? I know that Crystal mentioned it a little bit ago, but can you tell us a little bit about a background of it and how it's different from other MS therapies?
Sure. First, how it's the same. So all of our medications are designed to reduce relapses and reduce progression. We want them to have a good benefit to risk profile. Mavenclad fits that. All of our medications have risks, and so I tell patients about the unique risks or potential risks with each agent. The potential risks or potential serious risk with Mavenclad would be for pregnancy or women who are about to become pregnancy. I won't use it in patients with cancer. And I do warn them about the fact that our therapies often increase susceptibility to infection and therefore maintain a proper care. But uniquely, Mavenclad is a short-term therapy with a long-term benefit. Most of the therapies that we use are what we call maintenance therapies. We give them every day or every week or every month. And it's the maintenance of those week after month after year that characterize them. Mavenclad's different. You take it 10 days per year for 2 years. So for example, January 1st to 5th and February 1st to 5th for coming year, and then the following year, January 1st to 5th, February 1st to 5th, and then you're done. For patients, so our hope is that the short term of therapy will produce a long-term benefit and that they will not need to be on a Mavenclad on a long-term basis. In fact, won't be on Mavenclad for a long-term basis. If they need to know more for a deeper dive, we refer them to mavenclad.com for further information.
Well, thank you so much for all of this information and your time, and we do appreciate you sharing your journey with us there, Crystal. You guys have a great day. We do appreciate it. You can always find this segment and more on our website at First Coast Living.